Greetings everyone. As orthopedic surgeons, we operate patients of various age groups, right from children to adolescents and even to the geriatric population. Shoulder problems are quite common in the young age group, in which they come with complaints of pain and instability. Towards the elderly age group, it will be more of a frozen shoulder kind of picture that they'll be presenting to us. So today I have a privilege to interview one of our students who was a subscriber of Dr. Apurv Mehra's online classes, who had a shoulder issue. So in his young age, when he was a student of the medical fraternity, he had an issue with his shoulder, for which he was quite worried and came to us with that issue. He had consulted various doctors, and he was confused on how to go about with his surgery and treatment modalities. So we were able to counsel him, and he underwent the surgery, and now he is with us to give an interview. So welcome. So can you just introduce yourself to the general public?
Hello guys, I'm Shubham Agrawal. I'm actually fourth year med school student, and for around 5 years ago I had this shoulder dislocation. It's because of I was a swimmer once, and after some time it became recurrent, and uh, after getting so many consultations and physiotherapies, I got nowhere.
Okay.
And
So which side was affected, Shubham?
it was my left shoulder.
Okay. So Shubham had a problem with his left shoulder, which he describes as recurrent dislocation. So what is this issue? So initial stages, what happened is that the patient or the like Shubham, he had a small accident sort of a thing in which he had dislocated his shoulder. So what happens to the shoulder is that shoulder is a joint wherein the bony contact is very less. It is majorly the soft tissues that surround the shoulder joint that support the joint to move around. You know that shoulder joint, you can do any amount of movements in the shoulder joint. So that is what should be your movement in your shoulder. So the problem is that the bony contact doesn't give much support to the shoulder joint. So any small injury to the capsule or the surrounding tissues or the labrum, as we call it, if it is ruptured little bit, then the patient might feel some sort of a dislocation or a subluxation sort of thing. So Shubham had recurrent dislocations, meaning like when he tries to do normal activities also, his shoulder used to come out. So that was a quite devastating situation for him, because he was a swimmer and he used to do quite a lot of swimming activities. And as a youngster, obviously, this is a much greater concern. As you know, in swimming, you need that range of movements while you swim. And he was not able to do that. He was quite confused, like he said. He has gone to various people, done a lot of physiotherapy. But unless and until you address that problem, this problem doesn't get solved. So Shubham came to us, we advised him a surgery, and as he was already a doctor, it was not difficult for us to do a counseling, as he understood whatever we were trying to convey to him. And we were able to operate him almost 7 weeks back, Shubham, is
Yes,
it right?
doctor.
Yeah, so what surgery did you undergo? Can you just share your experience with
I
them?
underwent in an arthroscopic surgery with the labrum tear.
Repair,
and,
right?
Yeah, and labrum repair, and Bankart lesion also.
Okay. So what Shubham is saying is that his labrum, or that structure which supports the shoulder joint, was torn. So we were able to do arthroscopic repair of that torn labrum. So what does arthroscopy means? It's simply a keyhole surgery. In common layman terms, we call it a keyhole surgery, in which we make small incisions and we just go into the joint and repair that particular portion which was causing the issue. So, Shubham, just some, I know I met you in the first day when you were about to go for the surgery, and you were quite apprehensive. So, how was your total experience, the OT room, the supporting staff, and how was your
Well,
experience?
my experience was quite very good. In the first place, one of my relative underwent surgery through Dr. Apurv, and he was very sure that Dr. Apurv is one of the best surgeon for us. And as doctor told you that Dr. Apurv is also our teacher, so it's kind of faith that he had given to me. And after talking to him, he told me every risk and what are the chances of failure and what will be the my motion range after the surgery. So it was satisfying information for me.
Okay, so what Shubham was talking about is the counseling part. So any patient who has to undergo any surgery, we do something known as a counseling, telling about what exactly is the procedure that is going to be given to him, what are the likely chances that it might fail, or what are the complications that can be associated with the anesthesia as well as the surgery, so that they understand, and their rehabilitation also will be according to that. So all these things were conveyed to him, and he underwent surgery on October 28th, 2021. I think that was around 7 weeks back. And now at 7 weeks, he is there with us. And how is the function, Shubham?
Well, after the surgery, I was wearing a cuff, and around for the 3 weeks, I couldn't able to move my hand.
Okay.
And after that, I started medications and all, and now you can see I can uplift my hand at almost every angle.
Wonderful. So what Shubham was saying is that as we had repaired a tissue of their body, so that particular tissue, what we do is that we put something called as a suture anchor there, and we just tie it over there on its exact position, and we give it some time to heal. So during that healing phase, he might have to restrict some movements, that is during the initial 3 weeks or so, till the sutures are removed. So for that, he has to keep his upper limb in that particular position for 3 weeks, following which he was started on physiotherapy. So once he started on the physiotherapy, he slowly started achieving the range of movement that we were expecting him to have. And now you can see his complete recovery and results. So Shubham, when are you starting swimming?
It was when I was 14.
So at the age of 14, he had started his swimming activities, which had stopped in between. And now again, your surgery is over. So you are going back to your favorite sport activity.
Yes, definitely.
So how happy are you?
I'm very, very happy. After 3 years, I'll be able to swim. And Dr. Apurv assured me definitely that there's nothing like that I'll not be able to swim again. And once about 2 years ago, I went under an MRI, and there was a very little bit lesion, but the doctor was unable to get it. But after I went under another MRI, and I showed doctor the previous one MRI, he told me that there was a lesion 2 years ago also. So it was quite so precisely investigation by Dr. Apurv team.
Yeah, so some lesions are like that. Initially, it will be small, which might not be picked up by some surgeons, or might be ignored with supervision. So that is known as a supervised neglect. What we do, we just wait for some time to see if it is progressing or not. So unfortunately for Shubham, the lesion had progressed, and when he came to us, it was at the stage of surgery. So we did the surgery for him, and I'm quite happy to interview a doctor himself who's in his final year of MBBS, and I'm wishing him all the luck for his future adventures, and hope we'll have a doctor who's going to win one of the swimming medals in one of the competitions coming up. Just giving him a confidence from my side. Thank you, Shubham, for your time.
Thank you, doctor.
Yeah.